Hi everyone, I'm Sarah States. I'm the Director of Research and Science Education at Phipps Conservatory, and I realize we're between you and dinner, so I'll try to keep my comments short. This has been a great day so far, and as we are here to talk about our environment, I realize that our environment pervades everything we've been talking about today. You may wonder why someone from a botanical garden is here at the Lifestyle Medicine Conference, but our mission and a lot of my work is about advancing the concept that human and environmental health are connected. Whether we like it or not, our environment affects our health. And a couple statistics that kind of drive our work that we find really interesting are that physical and social environment contribute to more than 50% of health outcomes. And I think even more shockingly, we spend over 90% of our time indoors. I don't know about you, but I went from my house to here, sitting in this building all day, and then we're going to another indoor environment. So we can't ignore the fact that where we live, where we work, and where we learn really impacts our health. And so there's a lot of a good body of research showing how our environment can affect our health. I think there needs to be deeper studies, more robust studies. But one that I wanted to mention was the CogFX studies, the impact of green buildings on cognitive function. It's a series of 3 studies. I think the third one is still underway. But it's interesting because they're showing that occupants who work in green buildings, buildings that have healthier indoor spaces, have better cognitive, perform better on cognitive tests. There's lower rates of sickness, and we see better sleep patterns, better sleep quality among those individuals in green buildings. And at Phipps, we're very much as we'd love people to get outdoors and spend quality time in nature, we realize that's not always possible. And so we want to make the indoor environment a healthy place that people, so in green buildings you can be happier, you can be healthier, if necessary, you can be more productive. And 2 of the green building certifications that are out there that we have at Phipps are the WELL Building Standard and the Living Building Challenge certification. And these both prioritize human health. So the WELL Building Standard is focused on improving occupant health in the built environment, providing better air quality, access to natural light, improving physical activity, improving indoor air quality, and reducing exposures to volatile organic compounds. And the Living Building Challenge is even more robust than that, is more rigorous. It's also focused on improving the ecosystem and the indoor environment for health. And so, at Phipps we have 3 buildings that are Living Building Challenge certified. And so we produce all our own energy, or our electricity, we recycle all our own water, but the hardest part of the certification to meet was the materials challenge. We think that if there is a material that we can paint on our walls or the carpet that we put in our building, it must be safe if they're selling it. 2 anecdotes from when we built our Center for Sustainable Landscapes in 2012, not that long ago. We wanted to have wooden doors in the building. We couldn't find one wooden door that didn't have formaldehyde. And there's formaldehyde is on the materials red list, so it's these carcinogens, volatile organic compounds that are not allowed in building materials. And also there was one brand of carpet that we could use in 2012 that met our specifications. Fortunately, it's improved since then, but it's really important to note how many materials really are not good for our health. And, so a couple other elements of green buildings that I think are really important to highlight are greater ventilation rates. It reduces VOCs and CO2. If you're getting kind of sleepy in a room, I hope you're not too sleepy right now, it might be just really high CO2 rates in the building. And then separating out ambient and task lighting, these are other things to consider. They can reduce headaches, they can reduce eye strain, things that are affecting people in places that their work and their learning. And one more point that I want to mention is that I want to ask, who are we building these buildings for? Sometimes, in the short term, they can be more expensive, though over the long term, with improved health, and if you're producing all your own energy, you don't have an electricity bill, for example, they're less expensive in the long term. But are these buildings equitable? Who is benefiting from these buildings? And I want to go back to Mike's slide this morning about that African-American 10-year-old who had all of these afflictions. There are so many disparities in respiratory diseases that if we're talking about environmental health, we also have to talk about environmental justice. It's critical that we acknowledge the racial and socioeconomic and class disparities that we see in environmental health. So just to wrap up, I just want to emphasize that point when we're thinking about the environment and health. Thanks.
Thank you, Sarah.
Well, thank you so much for inviting me, Mike and Yoram. So I'm Esther Sternberg. I'm Director of Research for the Andrew Weil Center for Integrative Medicine and Director of the University of Arizona Institute on Place, Wellbeing, and Performance, which I established upon coming to the University of Arizona 7 years ago, linking the Center for Integrative Medicine, the College of Medicine, and the College of Architecture, Planning, and Landscape Architecture, to give a shout out to the botanical garden here. And the reason I did that is because when I was at NIH about 20 years ago, I was at NIH for 26 years, but about 20 years ago, the then Director of Research for the U.S. General Services Administration, Kevin Kampshire, came to me as a sister agency and asked if I could help him measure the impact of the built environment on health, well-being, and performance in order to keep the over 1 million non-military civilian federal workers happy, healthy, and productive in the over 370 million square feet of office space that the GSA builds and operates. And I actually, at the time, we used what are now dinosaur ancient wearable devices, and I didn't expect that we would find a benefit from the retrofitted, beautiful green office space of a federal building that we studied. But we did. We found, using objective measures of the stress and relaxation response, heart rate variability, salivary cortisol, that the new space actually did reduce the stress response in people in that new space, space that was light and airy, had good ventilation, lower mechanical noise, and had beautiful views to the outside. All of the things that we can add to the physical environment to enhance well-being. And so that's the single point that I want to make here. You know, getting rid of toxins is an absolute necessity. That is the ground floor of place and well-being. And Victoria Mays, our executive director, is going to talk more about that tomorrow. But there was a slide that Yoram, you showed at the beginning of the day, which talked about the 6 domains of lifestyle medicine. Physical activity, mindfulness, stress reduction, social relationships, sleep, addiction, and nutrition. The physical environment affects every single one of these. Place shapes behaviors that are important in health. I think that Winston Churchill first said something like that. Place shapes behavior, but I've added and health. And it does so passively. So in order to ask the question or answer the question that was asked earlier, how do you make people engage in these behaviors? Well, place can do that. And I'm going to show, oh, okay, there's the one slide. So this is the vision of the Institute on Place, Wellbeing, and Performance, to be able to measure using existing wearable devices in real time many aspects of health, including behavior, psychological responses, stress load, even sleep, and link them to, in the study, the current study that we did with the U.S. General Services Administration, measuring over 270 federal workers in 4 federal buildings, We use state-of-the-art wearable and stationary devices to link these health outcomes to up to 11 different environmental attributes. So what you see at the bottom of the slide is a study that we published last year in which we showed that open office design, which called bench seating, people in open office design are 32% more active than people in private offices and 20% more active than people in cubicles. And the people who are more active during the day are significantly less stressed at night when they go home, using heart rate variability as the measure of the stress response. So cumulatively, 14% less stress every single day is an important amount of stress that is a reduction that is medically relevant, and people are not even aware of this subjectively. The next slide. Well, okay. So this is a paper that just came out last week. We're using a lot of big data analytics to analyze all of these features that we have collected over the years. And we found that the range of temperature and humidity, and particularly relative humidity, that is optimal for the stress response is much narrower than the current ASHRAE standards, building standards recommend. So again, there are ways to optimize the stress response, reduce the stress response, simply by tweaking the building operations. You don't even have to build a new building. This all applies also to light, sound, and on, which I don't have time to talk about. But we also have studies showing that all of this impacts sleep quality as well. So I think I'll stop there, but it's a very exciting movement in the design professions to design for health, well-being, and frankly in the private sector, for the industry, for productivity and performance.
Thank you, Esther. I've got your punchline up here. Integrative health and preventive lifestyle medicine, individualized, smart, and adaptive design.
Thank you for completing my slides.
No, that was your take.
Well, that is the next piece.
Much.
The solution is to have automatically adaptive environments to optimize individual environments, but we can talk about that in the discussion.
I believe there's experts in the room who say that's very doable. It's a matter of willpower. Okay, Leonardo.
Hi, my name is Leo Trasande. I'm a pediatrician at NYU School of Medicine and study the effects of endocrine disrupting chemicals on human health. Now, when I was a medical student at Harvard in the late 1990s, I did get the benefit of having a nutrition module as part of my curriculum because I proceeded what Dr. Hu described as the gutting of that part of the curriculum, but didn't know what an endocrine disrupting chemical was. And that, in part, is due to the mantra that we've had up until recently, that the dose, only the dose, is the thing that makes a poison. Now, we had some red flags through the legacy of diethylstilbestrol exposure in young girls inducing cancers, as well as the saga of DDT that Rachel Carson described. But we banned DES in 1971, that is, the FDA did that, and the Stockholm Convention banned DDT, so we thought we were safe. Unfortunately, over the past 2 decades, we've seen a rapid acceleration in research suggesting that little things do matter, that low levels of synthetic chemical exposures can affect the hormones in our body and subtly undo the careful symphony of human development in so many ways. What we know is that at least 1,000 synthetic chemicals can disrupt endocrine functions. The evidence is strongest for 4 categories of chemicals in particular: the flame retardants used in furniture and electronics, pesticides used in agriculture, phthalates used in food packaging, cosmetics, and personal care products, and bisphenols used in aluminum can linings and thermal paper receipts. The earliest evidence that something was awry were studies documenting the effects of pesticides and flame retardants on the developing brains of kids. In the case of pesticides, we assumed that humans were special and more built to tackle the challenges of pesticides because their acetylcholinesterase was more inured to the effects of low-level pesticide exposures in contrast to little creatures that were more susceptible. But we didn't take into account the effects of thyroid hormone that ensue as a result of even lower levels of exposure. And now we have multiple longitudinal birth cohort studies consistently documenting decreases in IQ in kids who are more highly exposed, as well as matching deficits in MRI images of frontal and parietal cortex that match the neuropsychological benefits that are documented. There's a similar story with the flame retardants, again with multiple consistent longitudinal studies documenting effects. What's arisen, especially over the past couple of decades in particular, is evidence that there are chemical obesogens out there. Now, nothing I'm going to say is going to undermine anything Dr. Who or others have said in the context of today, that diet and physical activity aren't the most important drivers of obesity. Far from it. They're still the major factors. But environmental factors, and especially synthetic chemicals, are an important and under-recognized third factor that I argue are more amenable, lower-hanging fruit, to behavioral and regulatory change. So take, for example, bisphenol A or BPA used in aluminum can linings and thermal paper receipts. They make fat cells bigger, disrupt the function of a protein that protects the heart, adiponectin, and they're synthetic estrogens, and so can have sex-specific effects on body mass. The Teflon-like chemicals, the perfluoroalkyl substances that have gotten a lot of attention in the news as water contaminants, themselves can slow the body's rate of metabolism. Instead of turning this room hot, they turn the room cold, leading to excess adiposity and fat accretion as a result. Phthalates do something similar in terms of track switching caloric processing from protein to sugar and fat, ultimately. I won't be able to give, in the context of 5 to 7 minutes, justice to what happens in the reproductive tract, but what little we know is that the phthalates, these chemicals that make plastic softer, antagonize testosterone, which obviously is a concern for the men in the room with respect to sperm count, not to mention potency. But we're not literally talking about lifestyle issues. We're also talking about, in some cases, life and death matters. We've done a series of studies documenting that 10,000 adult men between the ages of 55 and 64 die each year because phthalates reduce their levels of testosterone, because low T is either a marker for or predictor of adult cardiovascular risks. And these aren't just life or death matters or human health matters. These cost our economy. We've done a series of studies documenting that, be it from cognitive effects or obesity or other metabolic consequences, that endocrine disrupting chemicals cost the US $340 billion a year. That's 2.3% of our gross domestic product. And that was based on less than 5% of known EDCs, a subset of effects due to those EDCs, and a subset of costs due to those human health effects. And yet, we see these very large estimates, and we've done a series of studies just looking at one chemical as a case study, bisphenol A, a hypothetical replacement scenario where the benefits associated with reducing exposure and 2 disease-related outcomes nearly matched the cost of a safer alternative, a natural one called oleoresin, assuming no adverse effects associated with that naturally derived alternative. So I've given you a lot of gloom and doom, but there's actually a lot of hope here. We've already seen, in the context of relative federal inaction on these issues, states leading the charge, and frankly, consumer action really driving the change we seek. You can see on the slide there's safe and simple steps we can all take to limit these exposures. I've just mentioned a few here. They don't necessarily require a PhD in chemistry or have to break the bank, but they also are the accelerator of change by manufacturers, quite frankly, who are increasingly taking on this charge with gusto. We saw, based on a study of just 5 food packages, that 2 major supermarket chains got the forever chemicals, the perfluoroalkyl substances, out of food packaging for buffet style packaging that is commonly used in supermarkets. A major supermarket chain, Ahold and Hayes, literally has committed to taking perfluoroalkyl substances out of their products. The whole BPA-free craze was not driven by science as much. There was science, don't get me wrong, but it was driven by consumer attention to this issue, and frankly, media and public attention that made the manufacturers who were dealing with these chemicals to realize that they had to change their ways, and they ran to the FDA, insisted on the ban, and got the change that we seek. So I hope in this brief synopsis I've at least given you the concept that endocrine disrupting chemicals arguably represent the second leading environmental challenge of our time, besides fossil fuel production, in which I tie together air pollution and climate change. But I see a lot of hope and a lot of synergy in the efforts and attention that increasingly the millennial and post-millennial generations are placing on climate change. If we attack fossil fuel production, we actually attack one of the drivers that actually underlies many of the synthetic chemicals and their production in the environment. So thanks for the time.
Leo, thank you very much. Leo has written a book that I forget the title right now, but it's very, very good, and I would recommend it.
There might be 3 words on the top of the slide that sicker, fatter, and poorer.
A couple of buzzwords, sicker, fatter, and poor, right? But particularly for our kids, a national challenge. I mean, we've got pediatricians here today, and Leo is a pediatrician. This is a big deal, and I think it's underrepresented, and it has to be done scientifically, but where the science exists, the powerful lever of a consumer, which is sometimes outside our usual domain and the way we think, is a potential tactic we could talk about more. Dr. Jackson.
Leo, as you were talking about those chemicals, I was remembering January of 2001. CDC, I was the director for about 10 years of the National Center for Environmental Health, and we had used the NHANES data, 5,000 people a year, and had profiled the chemical body burdens of the American people. Mrs. Pelosi knew all about it. In fact, she was behind getting $40 million for our laboratory a year to do this. But I remember the day the lab staff came in to me and said, "Dick, look at this." And it was a profile of phthalates phthalates are the softening agents in various plastics. At that point, 50% of a lipstick was phthalates. They're weak estrogens, but they are estrogens. They're weak carcinogens. And here was this graph across the age population. All of a sudden, there's this big jump and then back down again. Anybody want to guess who the population that had the big jump of phthalates in their blood and urine? It was young women. It was your daughters looking at getting pregnant or, going forward with their lives. Lead, by the way, had gone down. Cotinine, the breakdown product of nicotine, had gone down. That's a success story. But the other was bisphenol A. And we really didn't know a whole lot about bisphenol A, but there was a lot of it because there's a lot of food cans and the rest. So what's worked over the past few years in our society? And I would say food and food safety has gotten better. The number of pesticides that are permitted in food are about half of what they were in 1980, and the levels are tenfold less than they were in 1980, and now you can't spray chemicals right next to schools in many, many places. That was the good news, but where'd that come from? It came from a focus on children, because when you start setting standards on the basis of kids, you set more stringent standards. But guess who else benefited enormously and who was at the most risk from pesticides in the diet and in the environment? It wasn't the wealthier folks living in Monterey. It was the poor folks living in Karn County and Bakersfield and harvesting the crops. And literally, they had 500 times as much chemical exposure because they're out there in the fields. And so when you eat organic, you are actually lowering the amount of chemical exposure, not to yourself and your kids alone, but to our environment, very importantly, and to particularly the farm workers. And boy, if you ever go out in the hot sun and try and harvest strawberries for longer than an hour, you realize what desperately hard work that is. So we've made real progress on food. We've made great progress on tobacco. So About a year ago, I was explaining to my 30-year-old son, when you were little, we went back to New Jersey, we saw the family, went to the shore, it was great, but when we got to the airport, they bumped us and we couldn't get a seat non-smoking. What? Oh, come on, Dad, you're always telling stories. Of course there was no smoking on airplanes. Oh, no. We got rid of tobacco. The first step was flight attendants. It was the flight attendants organizing because they were so damn exposed, and then measuring the cotinine levels, the chemical breakdown products, in the flight attendants. And so there's a partnering around environment with worker issues that is extraordinarily important. But the second step, and it goes to kids again, all the kids were taught to go home and tell Mommy and Daddy, and particularly Grandpa, stop smoking, we don't want you to do it, and dramatic reduction in smoking. I won't tell you, well, I got my driver's permit back in New Jersey in 1963. The per mile death rate driving in America was 7 times per mile than it is today. I mean, that's incredible. What an improvement. 7 times safer per mile. We drive a lot of miles. And, when GM and Ford were told, you really got to worry about this, they sent a bunch of hookers out after Ralph Nader to try and compromise the guy and ran a big campaign about the only thing wrong with our car is the nut behind the wheel. And the obstacles to all of this were tremendous. And when I moved to California for medical school, and when California banned lead from gasoline, we were told there won't be any more cars in California. They won't work anymore without leaded gasoline. And God help me, I think that would be a dream not to have any cars in California because you can't go anywhere anymore. The 2 most boring topics of conversation are lack of housing, related also to homelessness, and the traffic. In fact, in LA, nobody goes. You're told when you move to UCLA that you should like where you live, because once you get home, you're never going to want to go out again because it's so hard. In fact, 100 years ago, it took about an hour to go the 7 miles from where UCLA is downtown. And today it takes an hour in a Lamborghini because it's just stop and go the whole time. So we've not really made much. So we've made good progress in science, but we've not made very good. And there are things that haven't worked. And I would argue, number one, our agricultural policy is crazy. And to be using fossil water, irrigation water from the Ogallala Aquifer in the Central Valley of California, been there for 1 million years, and we're using it to grow crops, oats, and other things to be shipped to Saudi Arabia to pay for their horses. Huge amount of water is being put on crops that don't belong in irrigated desert. You grow those crops somewhere where it rains all the time. I'm sure you have wonderful wheat and oats here. Corn ethanol is a complete sucker's bet. Every child in the Midwest is drinking Roundup, atrazine, and allichlor in their water because of the enormous amount of the corn chemicals now. And the amount of pesticides, particularly, get this, herbicides that are now being used on corn has been going up and up like this because if you use a lot of fungicides, you can crowd the corn more and more and more. And they've gone with crops that could tolerate enormous amount of crowding and lots of fluids. And most of that's now going to ethanol or to feed cattle that, once you feed them a lot of cattle, they have higher rates of O1Y7, E. coli, and other things. So our irrigation, our ag policy is irrational. Our health policy is irrational. As a friend of mine said, well, the American health policy is one of extortion. You give us all your 401k and we'll give you the surgery that you need. And I really do think that linking the insurance company to the care, which is what we have with Kaiser, has worked extraordinarily well. And you get the basic care very well done by Kaiser in California. But you're not going to get the most extraordinary extremes, but at least everybody's getting decent service. And it has driven the obesity policy. There's another thing around the health policy. I'm sorry, NIH. In 2000, the NIH budget in today's dollars was $30 billion a year. Today, it's about $35 billion a year. And you notice the very first slide that Mike showed showed that lifespans are decreasing in America. So $30 billion a year for the last 20 years, and we're living less long, and our data is worse than about 30 of the OECD countries for health status. So, and by the way, 0.07% of the entire NIH budget goes to the biggest and existential threat to humanity besides nuclear weapons, which is climate change. They're spending nothing on it, and it's a disgrace. We've had irrational housing policy. In Germany, housing is decided by the government, and they decide we need to have housing over here, and they're much more peremptory about it, and it has completely failed in my state and many other states to depend on the free market decide where we're going to give people housing. Housing is a human right, just like clean drinking water and decent air and food is a human right. Our fiscal policy has become irrational. This immense transfer of wealth to the wealthiest, and then looking at the top 2 to 3% having more money than the bottom half of the population. Sooner or later, we're not doing anyone any good with that. And our environmental policy, I won't even start because Leo did such a good job, but when I was born, the CO2 of Mother Earth was 300 parts per million. When Neil Armstrong was on the moon, it was 340 parts per million. Today, it is 414 parts per million. And you cannot have that much greenhouse gas in the atmosphere and not be experiencing extremes in the environment. So now that I've depressed you and me, I do think we have to get back to honest policy work as a country. I don't believe in totalitarianism. It's always a disaster. The Chinese are learning that in Hong Kong. Anytime we have turned to totalitarianism, it's a disaster. But capitalistic totalitarianism is a disaster as well. You can't let the free market and people out to make short-term benefits decide absolutely everything that we need. You have to have some level of governance. So I don't have the picture, but one of my favorite sculptures in the whole world is there in the Eastern Gallery of the National Gallery of Art in Washington, D.C. There, hooked to the ceiling, is a 6-petal Calder, IMP is the skylight, Calder mobile. Great big petal over here, a red one, and it holds up the next 5. And then down at the end, there's a little petal. Well, I'm going to argue that actually a rational policy would reflect that mobile. The big petal that holds up absolutely everything is nature, the natural world. And when we defy it, the thing collapses. My friend, Mother Nature always bats last. The next one coming down is culture and civilization and how we treat each other. This stuff we're barely aware of, but that's how we depend all the time on other people understanding the culture, even to the point of what a red light and a green light means. The next one down, and people think I'm really a right-winger, is governance. I'm not saying government necessarily, but governance. If you don't have governance, the thugs run the world. You have to have law, you have to have governance. We're having quite an education in this right now. There have to be rules that people would operate by. And in the United States military, those rules are very real and people are deeply respectful of them. You don't argue with the general. Below governance, what does governance create? And this is really important. Governance creates infrastructure. Because commerce doesn't want to pay for something that's got a 100-year payback or a return on investment. They want something that's going to pay them back in the short term. So it's only government that pays for deep infrastructure. And you have to tax, you have to do all those things. But good governance actually creates the wealth. I've often wondered why South America, the countries are so poor, because they were intrinsically as wealthy as the North America. It's just they didn't have good governance, is my opinion. Almost done. The next one down, below governance, and a lot of people wouldn't like this, is commerce. Business comes after this, because commerce generates wealth, and it does a very good job at it. But it isn't holding everything else up, no matter what somebody's telling you. The business world depends on good infrastructure, good universities, good roadways, good electronic, good grid, good airports. And the last one is what we've been talking about today, which is beauty. It's happiness, our children's development, the future that we can offer people. And when they're in balance, everybody benefits. And I just such a pleasure listening to you all today, and I thank you for making me last. You didn't know I wanted to do this, so I really appreciate it. Thank you.
Thank you, Dick. Thank you very much. Let's take 2 comments or questions. I would be remiss if I didn't mention Dick Jackson's book, which was built on his many years of leadership at CDC around building healthy environments as the foundation, not the afterthought. That's my buzzwords, but please read Dick's book as well in that regard.
Can I give a shout out to my book too?
Oh, absolutely, Esther. Go ahead. I just haven't read your book. Go ahead.
It's Healing Spaces, The Science of Place and Well-Being.
So, Yorm, go ahead.
I'll give a plug for work done by Matthew Rosengard in our department, who's shown that blue light, which we have other issues with, but actually ends up enhancing immune function and improving outcomes following especially surgery and sepsis, etc., and has a trial wherein ICU lights are going to be, or are already changed to help with that. But one can imagine, what are these patients breathing? What is on those beds? What is on those doors? What's in the food? And so maybe you guys could comment on that, because obviously, obviously lifestyle medicine is aimed at trying to have people kind of improve their life through their daily interactions. But at some point or another, they are sick, and the question is the built environment of the hospitals a major issue?
So I actually I have a whole chapter in my book about this. And it is the earliest field of the design professions that paid attention to designing for health were healthcare designers. And the earliest article about this was published in 1984 by Roger Ulrich, who showed in patients recovering from gallbladder surgery who had a view of a grove of trees instead of a brick wall, that they had less pain medication, fewer negative nurses' notes, and they were discharged about a day sooner than patients who had a view of a brick wall. And this study has been reproduced over and over and over again in the last 3 decades or more, and with more and more sophistication. Robert Wood Johnson Foundation coordinated a study called the Pebbles Project, where they looked at 50 different hospitals which were retrofitting different wings, and they measured health outcomes as well as patient satisfaction and nurse and staff satisfaction and turnover. And they found that when you design hospitals in that way that we've talked about to optimize the built environment for health, you not only have fewer medical errors, fewer infections, less nursing turnover, more nursing satisfaction, patient satisfaction, and family satisfaction. And so the good news is hospitals are more and more being designed in such a way, and I could name a few, but to really try to enhance these aspects of the physical environment, reduce noise. There is no reason that you have to have all this beeping and waking people up in the middle of the night in a intensive care unit. That's terrible for healing. Certainly airflow, carbon dioxide reduction, temperature optimization. Places for social support is really important. These are being built into hospitals now. Patients, and also it's relevant for elder care, residential communities, so that's the good news. The good news is it is being instantiated across design of hospitals, and it is now beginning to be taken into office design, and school design should be next.
Great. One more.
Especially in America, where there's so much varied types of homes, right? So do we have data or is there research on that area?
Yeah,
Whereas in Europe, it's because a lot of those housing is through governance. They have a little more data there. But for us, I'm not I'd like to hear that.
So there have...
How, for example, are those people in the suburban areas are they doing any better or worse than
so
those
they're
in the
similar
urban?
to the Roger Ulrich study. There was a famous study by Sullivan and Kuo in the Chicago inner city projects, where they found that people who were randomly assigned to apartments that had a view of a grove of trees instead of a blacktop had better social interactions, less violent behavior, and so on. So there are some studies in that regard. At the University of Arizona College of Architecture, our architects are designing for low-income housing, which, when you look at it, looks absolutely as beautiful as anything on HGTV, and incorporates all of these features. So it is possible to do. Harder to measure individual homes, but it can be done. And the other piece is for aging. Aging in place is a big push in the design communities.
I just want to add a quick comment that there's a lot of emerging technology in this space that provides, I didn't have a chance to give research a full shout out, even though most of my time is NIH funded research, but there are now these devices, Google, Amazon, et cetera, that are starting to incorporate Internet of Things kind of ideas, such that you can measure volatile organic chemicals and even ozone and particulate matter in the homes that'll permit the kinds of examination of respiratory as well as cognitive effects of indoor air pollution, which is really an underappreciated, under-recognized phenomenon. We focus mostly historically on lead and mold in particular, maybe formaldehyde, but there's a host of other exposures that are underappreciated in the indoor air.
The issue of if you create quality density, if you're creating housing, one is what we did in the past is when we created so-called projects, it was really crappy and people did not take care of it, didn't have sight lines, didn't have sound insulation, had poor heating systems, because they basically cut the budget for the last 20%. And so we've really got to invest in decent quality. In Europe, when they create this kind of density, they put lots of amenities for bicycle transport and for children's play areas and people to come together. And it goes back to the earlier talks about loneliness is a disease.
If I can jump in too, just briefly. If we're trying to move the needle on research here too, I think focusing on environments for our children too, where they spend a lot of their time, is crucial. So there's research in homes, a lot in workplaces, but also in schools. We're seeing improved test scores, improved attention when you incorporate green building elements. And we have to think about climate change in the future. The effects that we're going to see in urban environments are, poorer air quality, extreme heat, extreme droughts. So we have to focus on resilience and create spaces that are healthy for everyone, not just in the workplace, in our homes, in public housing, in schools as well.